On the air tonight, the hepatitis A epidemic is growing.
Since our exclusive reporting at 6 o'clock about a food handler at Eulalie contracting the virus, the I-Team found out about another employee at a popular restaurant who had the infection. The
Tampa Bay area is ground zero for the hepatitis A epidemic. In brand new numbers obtained by ABC Action News, there have been 332 cases of hepatitis A in Pinellas County just this year. In Pasco, 277 cases, and in Hillsborough, 168 cases.
I've been closely tracking the rising number of hepatitis A cases for months now and pressing people in power on why they're not telling the public. New tonight, I uncover why local health departments are not being as forthcoming as you would expect with the health and safety of you and your family on the line.
Clearly, hepatitis A is a concern. It's a concern not just here in this county, but throughout the state.
As hepatitis A continues to spread, with over 1,000 cases in Florida so far this year, Lieutenant Governor Jeanette Nunez visited Pinellas County, one of the centers of the epidemic, to see how they're protecting the public.
The importance, from my perspective with this visit, is really understand what they're doing from an outreach perspective, but also making sure that the public understands that there are ways to prevent. Obviously, good hygiene is important, vaccinations are important.
But informing you, the dining public, of a restaurant worker with hepatitis A is not part of the protocol. The Pinellas County Health Department tells all employees to get vaccinated when a hepatitis A case is identified at a restaurant, so why keep it a secret from those who eat there?
So we certainly don't take that serious lightly. We follow CDC as well as DOH protocols, and what we do is look at some of any food worker that's been infected with hepatitis A. We go and look at some of the symptoms, whether they were a threat to the public.
Dr. Yuli Cho, the Pinellas County director, says he decides what is a threat to the public by focusing mainly on the restaurant's sanitary practices.
We look at and do a joint assessment with DBPR to see hand hygiene practices, and if it rises to the level and deemed a public health threat, that's when we make a public notification.
But if it's such a health threat, they vaccinate every coworker of an infected restaurant employee. Why not also warn the dining public?
Because that we follow CDC protocols. It's always recommended that the coworkers do get vaccinated. And again, we only make that public notification when it is deemed that public health threat.
This is the first time we've been able to talk to Dr. Cho. He's refused past requests to speak to us about the epidemic. And it may be because of his busy schedule. This county director has 2 other jobs at USF and TGH, just like we uncovered about Dr. Douglas Holt, the Hillsborough County Health Director.
In terms of the duties that I have at USF, it does not interfere with anything that I do here.
And the county's communications director also stands by her refusal to inform the public, blaming it on a state law.
381.0031 is a Florida statute. Epidemiological investigations are considered confidential.
A double standard, since the department lets restaurant workers in on that confidential information, telling them if they've been working alongside someone with hepatitis A and urging them to get vaccinated. But you, the diner, not allowed to know, even if you eat there on a regular basis.
We don't identify places where we do investigations.